Voice surgery, at the best of times, can be a daunting experience. During the surgical procedure, we have virtually no control and we have to trust in the skills of the surgeon and the theatre staff. But the moment we wake from general anaesthetic, we become an active player in our post-operative recovery. So what can we do after phonosurgery to secure the best possible outcome for ourselves and our voice? Well, I'm glad you asked. Stick around, I've got some super handy tips that will have you up and singing again real soon.
Sound check. Check 1, check 2.
Hello there, my name is Dr. Dan and I'm a singing voice specialist. It's my job to help you get the very best out of your singing voice, and sometimes my expertise is applied to singers who are recovering from vocal fold surgery, what the medical profession call phonosurgery. As I stated in my introduction, phonosurgery can be a scary scenario for many singers. For some, having their voice operated on is akin to losing all personal control. It can be a time of feeling highly vulnerable and helpless. These are all very real feelings, but rest assured, if you are under the care of a skilled surgeon who you trust, there is no reason to feel that the surgery won't be a complete success. And as we continue into today's video, it's important for me to state that the information that I'm about to provide you with should in no way be used to supersede the instructions that you have been given by your laryngologist. Let me be clear. Always follow the instruction of your surgeon. They are ultimately responsible for your post-operative recovery. But if for some reason you don't trust their instruction, seek a second opinion from another surgeon, not YouTube. Yes, the information I'm about to provide you is sound and based on latest research, but that does not mean that your surgeon is not the medical professional best placed to direct your vocal recovery. So, with that important caveat in place, let's talk through some of the things that you can actively do to enhance your post-surgical recovery.
Sound check.
I think the first question every phonosurgery patient asks is, when can I start talking again after surgery? That's a good question. The current approach is for patients to observe between 0 to 14 days of absolute rest. That is, no sound making of any form. The length of absolute voice rest will be dependent on your surgeon and the type of surgery that you're receiving. For example, many laryngologists will instruct the patient to start talking within 48 hours following the removal of bilateral nodules, whereas more intrusive surgical procedures, for example, the removal of laryngeal cancer, may require longer periods of post-operative silence. As surgical practices advance and develop, the need for extended periods of absolute voice rest is being reduced. Once you've been given the go-ahead and to recommence talking, you enter the second phase of your recovery called relative rest. Relative rest is defined as clear, normal, level speech that is neither loud nor whispered, and your vocal loads should be relatively less than the everyday vocal activities. So, for example, speaking for more than 2 to 3 minutes on the telephone when on relative vocal rest would be deemed too much. Talking in loud environments such as cafes and restaurants would also fall outside the boundaries of what is considered a relative rest. You should also do your best to avoid throat clearing, coughing, crying, excessive laughing, and heavy lifting during your post-operative recovery. Each of these activities places the larynx and vocal folds under extreme load and can compromise the healing process of the voice. Now, relative rest should be observed for between 7 to 21 days, during which your post-operative therapy should commence.
Sound check.
No vocal surgery is complete without post-operative voice therapy. Some specialists advocate for resonant vocal activities in the 2 to 3 days immediately following the surgical procedure. And while the question of how soon is keenly debated amongst voice professionals, it is widely accepted that voice therapy should have commenced in most cases within the 2 weeks following surgery. Again, you are going to need to be directed by your surgeon, but if there is no advocacy for post-operative voice therapy, I would encourage you to inquire as to why not. And if necessary, seek a second opinion from another laryngologist. Post-operative rehabilitation for the voice should take between 5 to 10 sessions with a speech therapist and, where appropriate, a singing voice specialist like myself. Your voice therapist will guide you and your voice along a path of exercises designed to slowly but surely strengthen the voice, all while assisting the post-operative healing process. I cannot stress enough the importance of your post-operative voice therapy. It literally can mean the difference between returning to full healthy voice use, or alternatively, returning to the surgeon's knife for secondary procedures. I typically instruct my rehabilitation clients to wait approximately 2 to 3 weeks before the introduction of light singing exercises. Singing places the voice under higher loads than does talking, so I think it prudent to walk before you run. Singing rehabilitation generally takes between 6 to 12 weeks, after which, if the client has been diligent and there are no obstructive circumstances, full voice use, both talking and singing, can be returned to with every confidence. Perhaps you have a question about vocal surgery that I have not covered in today's video. Feel free to write your questions in the comment sections below and I'll do my best to answer them promptly. In the meantime, I'd love you to check out my channel for more videos about singing. Each one has been designed to develop your voice and improve your sound. So until I see you in the next Voice Essentials video, I'm Dr. Dan. Sing well.